My wife and I had just celebrated an anniversary with a group of hens, a marvelous lunch, but I was feeling unwell, got through the lunch without anybody really knowing that I was in considerable pain. But by the end of the afternoon, I couldn't lie down, I couldn't stand up. And my wife took me to the Ottawa Hospital emergency, where fortunately there was a physician, a very experienced physician on charge. Took a look at me and he said, you know, there's a possibility here that you may be suffering from an embolism, and I think it's really important that we get you to the thrombosis clinic as quickly as possible.
The Thrombosis Research Group does research from prevention to diagnosis to treatment of blood clots in a variety of patient populations. If Mr. D'Aquino would have came to us 12 years ago when I was in medical school, he would have been admitted to hospital and waited until Monday to get his scan to prove that he had a blood clot in his lung. Would have been treated in hospital with intravenous medications for a week and then discharged on oral blood thinners. So Mr. D'Aquino, as a consequence of the research that we've done, was able to be discharged from the emergency room the day that he came in and treated as an outpatient and returned to the important work that he does.
Pour moi, l'institution, c'est tellement important parce que la recherche de Dr. Roger et de ses collègues c'est vraiment une recherche pour sauver des vies, comme il m'a sauvé ma vie. Et c'est pour cette raison que je dis sans aucune réservation que le travail de la clinique ici est tellement important.
We've come a long way from having patients with blood clots admitted to the hospital, where now they're completely managed as outpatients, and that's very exciting. These new medications that are being developed also have a lesser risk of bleeding. Less risk of bleeding means that they need less monitoring. So again, it's improved quality of life, and for that, that's really exciting.
Everyone at the clinic has always treated me so well. And from everyone from that wonderful old lady with the booming voice who's in the reception area, who always knows my name, to the staff that works with Dr. Roger, I've just had excellent treatment.
Research is important to patient care for patients locally because they're delivered the innovations first. They become first adopters of important innovations in healthcare. Research is important globally and over time because it changes practice, not just for patients now, but for patients in the future.